thought that massage was so much about sort of thumbs and having to push really hard, and my hands get really tired. And I found that as the subject, some of the things I liked the best were just the parts with just steady pressure, where Bud would just sort of put his weight on me, and I really, really liked that.
Cuando llegué esta mañana, me sentía mucho dolor en la espalda. Y con esos masajes me siento mucho mejor ahora. También puedo enseñarle a alguien que tenga el dolor, explicarle un poco como lo que han explicado aquí. Entonces, una bonita experiencia porque me sirve a mí y me sirve para ayudar a otros también.
When you go through cancer together as a couple, there are many experiences you go through that are very difficult. And painful and hard, and so this is a wonderful thing we can do together. That's loving, and kind of counteract all of that pain and those difficulties.
While I'm here as a patient and he is my caregiver, sometimes in that difficult role of cancer and whatever else may cross our paths or our family's paths in time to come, maybe while he'll reach out to me with these techniques that we learned today, which are pure heaven, I also learned that I can reach out to him as well. So as we go down this path of life together, we can help each other through what we learned today. So thanks very much.
I'm a firm believer in training caregivers. People don't realize how difficult things are for sometimes the caregivers. Sure, we know what the patient's going through, but a lot of people don't realize what the caregivers, whether it's a spouse or a mother or a child taking care of the cancer patient. And so this allows them to be able to be a participant.
Caregivers need practical tools to be able to feel empowered to help the cancer patient. For example, a lot of people don't know the right way to massage somebody else. They may be afraid to do that. They don't know how to do that. But by having some skills and tools to be able to do it, they'll be able to connect more with the patient. But even more so, they'll feel better themselves. They'll feel like they can make a difference.
The connection between a caregiver and a patient is very important, and it most likely is going to be that this type of project, where you do have touch and massage going on between a caregiver and a patient, is going to just improve the relationship and also improve the general outcome.
In the spring of 2007, 11 people with cancer and their caregivers came together over a weekend in Boston, Massachusetts, to learn how people can provide comfort and well-being to their loved ones with cancer through the simple use of touch. Sponsored by the National Cancer Institute, the program was developed by Dr. William Collins, a researcher and practitioner of behavioral medicine who helps people meet the challenges of illness by integrating supportive therapies with regular medical care. The instruction was based on scientific evidence that people with cancer can benefit from techniques of touch that anyone can learn and apply.
There's a lot of research in recent years indicating that touch and massage can have a profound impact on the well-being of the cancer patient. For example, a large study at Sloan Kettering Cancer Center in New York recently studied over 1,200 patients and found that one massage of as little as 20 minutes could cut symptoms and side effects of treatment in half. So imagine if a care partner at home could give that kind of relief, say 2 or 3 times a week, what a profound impact that could have for the patient, and also the satisfaction that the caregiver could receive from that.
The first thing that we want to do today is to remind you all of the reason why we're here, which is to learn some very, very simple ways to support the person with cancer. We're not here to cure cancer. We're here to help produce relaxation and comfort for another person.
Each of the participants who came to Boston for this instruction has had cancer change the course of their lives.
I had discovered a little bump while we were on vacation, and so I went to follow up and was diagnosed with cancer shortly after that, and then kind of the world went upside down.
So about a little bit more than 1 year ago, I had a pain in my stomach, so I went to see the doctor. The doctor wasn't very certain about what was wrong with me. And then after through all these tests and lab work, through the biopsies, so they found out that I had a cancer called sarcoma. And so I follow all the treatments arranged by the doctors, and I'm on medication now. And I was told that it's impossible for me to have all the tumors in my stomach to be removed.
Me descubrieron en mayo del 2006. Y es un tipo de cáncer, es el más agresivo. Se riega más rápido en el cuerpo.
We were set to go take another trip around the world and be in Southeast Asia for 7 months in end of October. And November 1st, we were going to take off. And I had a routine physical. So the guy asked me, when's the last time you had a liver scan? Because I have hepatitis C for 31 years. I said, oh, about 12 years ago. Well, I think, he said it would be a good idea to get a liver scan, just in case, just test it. And so I had a scan, and so they had shadows on my liver, and then we went through a series of other scans from ultrasound to CAT scan to MRI, and sure enough, I had 3 tumors in my liver.
Well, it was really rough going in the beginning because we anticipated being away traveling for 7 months, and because of that, we had rented out our house. So right after we got the news of Richard's diagnosis, we had to leave our house and give it up to the renters. So there we were with no place to live and trying to deal with the cancer diagnosis. So it was really tough.
They came to the workshop to learn new ways of coping with cancer. They hoped these simple skills would help them to better manage not only the pain and discomfort of cancer and its treatments, but also the stress that affects the caregivers and the quality of their relationship.
Well, typically in cancer treatment, the emphasis is on the doctor-patient relationship, but this is a way of expanding the team, if you will, to include the caregiver in a more active, engaged way so that the caregiver becomes part of the team. And so not only is the patient being empowered, but the caregiver as well.
Since my mom's been sick, I've always wanted to know a better way to help her out somehow, some way, because, chemo and radiation, that's hard for anybody to go through. It's hard for anybody to bear. And sometimes you feel helpless because you can't help that person.
Most of the time she takes care of me. She's stronger than me. Even though she goes through what she goes through, she's more stronger than me in some points. So when she told me about this program, then I said, why not? Because I have 2 sisters with cancer, it doesn't hurt, to know more about it.
Above all, each of the participants volunteered to join this project in the hope that their experience could help others down the long road of living and loving while dealing with cancer.
When I was in the waiting room at the hospital every day for my treatments, you see people in all different stages of cancer, and I became friends with 3. And I know that if I knew today what I knew then, just maybe a little touch here would have been a wonderful thing.
Through this program, you will learn safe and simple ways of using touch to provide comfort and relaxation for the person with cancer, as well as greater satisfaction for the caregiver. The instructors are Dr. Janet Kahn and Tracy Walton, 2 nationally recognized experts in massage for people with cancer. This DVD is divided into chapters to make it easy to use. Watch the chapter on safety first, Then the preparation chapter on positioning, communication, and frame of mind. The chapters that follow will show techniques to provide comfort to different parts of the body: the head and face, neck, shoulders and back, hands, and feet.
Another thing you can do.
There's also a chapter on reducing symptoms through acupressure.
The caregiver experience is very stressful. Instead of having the stress of the experience tear them apart, what can they do to really get through it together? And, you know, that's why I think this program is so wonderful, because it helps both the patient and the family member to be united and to say, what can we do together to get through this?
Many people have some concerns actually about whether it's safe to give massage to a loved one who has cancer. I think some people have particular concerns about whether they're going to spread the cancer in any way, and other people are just concerned about whether they're going to hurt somebody, whether there's any kind of harm they can do. I want to say really clearly, as both a research scientist and a massage therapist, that there's no indication that offering massage to someone with cancer causes metastasis, spreads the cancer in any way. You can have every assurance that you're going to ease somebody's pain, that you're going to help somebody relax, which in and of itself decreases pain. There are certain things to be careful of, and we show techniques in the workshop to take care of those situations. For every person, there is some kind of massage, some kind of touch that can always be done, that is absolutely safe and good and can offer comfort. But there are a few situations in which we want to be careful about the level of pressure that you put. So we say you would do a pressure adaptation. You would use only light pressure in some situations.
We use the phrase lotioning a lot. What is the pressure you use to rub in lotion?
So you can see the skin moves, but I'm not compressing to engage a muscle. If the person you're working with has a tumor, an active tumor site, whether it's the primary tumor or a site where there's metastasis, you don't want to compress directly. You don't want to put pressure directly on the tumor.
Sometimes cancer spreads to a person's bones. Consult your doctor about the stability of your bones and any positions, movements, or pressure you should avoid. When bones are fragile, very light touch with soft hands and no pressure can still feel good. Be gentle moving and positioning the recipient. There is more information about this in the manual.
If someone has a medical device like a port, then you just adjust your pressure. You don't rub. You wouldn't pull or stretch at that area. Mary has a port going on right here on the right side. Ports are bigger than they look underneath the skin. Mm-hmm. So we don't tug. You know what? How big is it? Can you show us? Yeah. There's a whole well under there. They're bigger than they look. There's all sort of an underground presence to a port.
Simple, caring touch with no pressure or movement of the hands is safe and can be comforting and satisfying by itself. A hand can even be cupped over a port without touching it or placed next to it to bring comfort to the area.
People ask sometimes, will we be massaging the legs? And we won't be massaging the legs in this project, in this particular project. There are some things about cancer and cancer treatment that increase the risk of clotting in the legs. So since we don't know when that's happening or when it's not, we'll leave the legs out for this project.
In this workshop, we're also not showing any particular techniques for the arms. And that's a decision we made because for women who have had a mastectomy and who are experiencing some lymphedema in the arm, first of all, it might not be comfortable to receive massage. And secondly, the best massage for them to receive would be from a professional who's trained in manual lymph drainage.
If the recipient has had lymph nodes from the underarm removed or irradiated, use only very light touch on the chest and back on that side of the body. You can use more pressure on the neck and shoulders above the collarbone. If any other lymph nodes have been affected by cancer or treatment, consult your doctor about whether massage poses a risk for lymphedema. See the manual for more details.
In the manual, we have a list, sort of a checklist of situations you might run into having to do with medical equipment or having to do with tumor sites. And we encourage you to take that list to your physician and find out exactly which things you need to pay attention to, and then the precautions for those are right there.
The participants learned that there are several things to consider in preparing to use touch as a form of caregiving. Both people need to be in comfortable positions. They need to communicate with each other about what feels good and what doesn't. And the caregiver needs to be in the right frame of mind in order to be most effective.
The key things are not tricky techniques. The key things are really your own attitude, just that you come forward with love, with care, with that intention to provide comfort. And the other thing is that you make sure that the person literally, physically is comfortable.
Let your legs rest completely.
The instructor showed 4 primary positions for using touch and massage techniques: sitting in a chair, lying face down, lying sideways,
With 1 or 2 pillows under the knee.
and lying on the back.
This is nice if it's plumped up just a little bit.
So we're going to show you, as we do the demonstration, a lot of ways to use pillows and blankets and towels to make sure that whatever position you're putting your recipient into, you have him or her absolutely comfortable.
Between there and there. Just elevated.
The participants were taught to use pillows and blankets to prop and support the recipients so they are stable and their muscles are relaxed.
When someone's lying on their back for too long, sometimes it puts a strain in the low back. So what we do is put a pillow under the knees. And often 2 pillows under the knees will feel even better than 1. But you don't know if 2 will feel better, so now we ask, you like 1 pillow, 2 pillows, or none?
Okay, good.
This is good?
No, okay.
Yeah, good.
Yeah, okay.
Okay. Some of us are going to work with the back in the face down position, and some of us are going to work with the back in the side lying position. Both positions benefit from some really good manipulating the different pillows and supports. This is going to go further down. Great. And we'll make a little nest for the port. Okay. All right. We've got a kind of nest under here that the port can sit in.
Now I'm going to ask you to have your bottom leg be straight. I'm going to put this. Yeah. I'm going to give you this to hold. And the reason we give something to hold when the person's on the side, partly it's comforting, but also they have something to push against, because we're going to be on the back and I don't want her to roll. I'm going to give you the blanket to hold. That's okay?
I'm fine.
If you can come around to the back and sit in this. One thing I might do is I'm going to add this at your waist.
Okay.
I'm going to fold that down. I'm going to add this. And I'm going to add some towels to make it higher.
Okay.
Sometimes a pillow is just too much extra, but a couple towels is just right. I gave her, if you can lift your head just 1 minute more, this extra roll here, little triangular roll here. I gave that to her to rest her head against. can put it back
While the
down.
participants at the workshop used massage tables, most people will need to adapt these techniques to the furniture and spaces available at home. The kitchen table can be an easy place to provide massage to the back, shoulders, neck, and head. Turn the chair sideways to get better access, and use pillows so the recipient's muscles are fully relaxed. You can also massage with the recipient leaning back against the caregiver. The seated position can be very effective for people who cannot lie down comfortably, such as those with breathing difficulties, pain, recent surgery, or medical devices. On a sofa, make sure the recipient is lying so the back and neck are comfortable, with legs propped on pillows to reduce strain on the lower back. Make sure that the caregiver is also comfortable, not hunched or leaning too far. You can also sit in the couch together and have excellent access for foot massage. The bed is a wonderful place to receive massage. For best access, have the recipient lie toward the foot of the bed and close enough to the edge so the caregiver doesn't need to reach too far. The back can be accessed well with the recipient lying on his or her side. Have the recipient hug a pillow in front for stability. Straighten the lower leg and use pillows between the legs to keep the hips, back, and neck straight and relaxed. The caregiver can sit, stand, or kneel depending on the height of the bed. Another position for back massage is to have the recipient lie face down with pillows under the abdomen and chest so the neck is comfortable and the spine as straight as possible. Support under the feet will take strain off the lower back. For head or foot massage, you can also position the recipient diagonally with pillows under the knees for comfort. At the workshop, the instructors emphasized how important it is that the caregiver is comfortable.
You know, that she just asked a good question, which was, was she far enough back? And if she were too far down, I would be having to strain to get to her, and I might start feeling it here. So in fact, if we have her come probably just a few inches more, then I can easily reach her. And this can be done, suppose the bed is, has a headboard, just do this with the person flipped so the head is at the foot of the bed, and park a chair or a stool, or you can even, one of my favorite ways to work is to take 1 or 2 pillows and kneel at the end of the bed. Okay, the pillow thing being the operative word for my knees. And I don't stay here for a long time, but a few minutes is usually okay, and even better sometimes is this. 1 knee down and 1 foot down. So you can see, you'll find out what's good for you. Is that okay? Mm-hmm.
The instructor showed how to use lotion to reduce friction and make the massage feel better.
Actually, it's a fair amount of cream on your hands so they don't stick so much. Then there's a whole
Beyond physical comfort, it's important to talk to each other about what you want and what feels good.